One. You're live.
Hello and welcome to the Thursday community meeting where we're discussing updates to COVID-19. I'm Tracy Chula, the Pitkin County Public Information Officer, and today I'm joined by a great panel of folks who, one, are going to provide some information on the data. Our team from Aspen Valley Hospital is going to provide an update about where things are looking for the hospital. And I'm really excited to have Allison Daly, the Executive Director of Pathfinders, join us today with a message of resiliency, which I think we're all in a space where we're really ready to hear that kind of message. So thank you all for being here. So again, I want to introduce everybody on my panel today. So I have CEO of Aspen Valley Hospital, Dave Ressler, Dr. Catherine Bernard, and is it Chief of Staff or is there a different word they use for you, Dr. Bernard? You can tell us.
Chief of Staff, which also means President of the Medical Staff.
There you go, and thank you for putting me on that right track for that. Josh Vance and Charles Bickert, who are both Pitkin County Public Health epidemiologists, and then as I mentioned, Allison Daly, the Executive Director of Pathfinders. So with that said, it looks like we're going to start today's meeting with Josh. So Josh, welcome to the team. I know it's kind of funny that this is the first time we're seeing each other, not really in person, but on Zoom, but we're really happy you're here today.
Well, thanks for welcoming me. I appreciate it. Okay, can everyone see that okay? So good afternoon, everyone who's watching and to the panel. My name is Josh Vance, and I work as an epidemiologist here in Pitkin County along with Charlie Spickert. As many of you have probably seen in the news, multiple states are beginning to see an increase in their number of COVID-19 cases and hospitalizations. Here in Pitkin County, we want to ensure that we are staying ahead of the curve and keeping our community safe. And part of the way we do that is by observing and learning from what is happening at a national level. So I'm going to first walk through what we're seeing nationally, and just to be aware that the data is quite alarming, but we can use this to help inform us on our next steps. After sharing the national data, I'm going to walk you through our data dashboard and talk through our roadmap as a county and kind of explain to you where we're at and what we're seeing right now at a county level. So this chart comes straight from the CDC's COVID-19 website, and it documents the number of newly reported cases per day. One second, let me close this. So you'll notice that we had a peak in early April with ebbs and flows to follow. Then from mid-April through mid-May, it appeared that our case counts were beginning to decrease. But you'll notice that the case counts have begun to once again increase within the past 2 weeks. This is concerning for many reasons. We spent weeks and weeks locked down. We shut down businesses, we stayed home, we stayed away from others, and it seemed to have worked. We flattened the curve, we reduced cases, and our case numbers really did reduce. But now we're starting to see our case counts increase again as our habits and behaviors begin to slowly change. This is the same chart from the previous slide, but only looking at the past month, from May 26th to June 23rd. On May 26th, we had 16,429 cases reported across the nation, as you'll see on the left side of the screen. But if you look at our counts on June 23rd, just 2 days ago, we had 34,413 newly reported cases in the U.S. That's a drastic change within the period of just 1 month, when a significant proportion of the nation continues to adhere to social distancing practices and wearing their masks. But this is what happens when we begin to become complacent. And even more concerning is how the U.S. compares to the European Union. So this data comes from a program called Our World in Data, which is a program that's based out of Oxford University in England. It documents the number of newly confirmed cases in the U.S. and in the European Union. When we compare these two, the reason why we compare these two is because we have a similar population size, the U.S. versus the EU, and our demographics are moderately similar. So they're a pretty good comparison point when we're looking at national level data. The EU, which is shown in dark blue, peaked around early April, then fell steadily and are now keeping their case counts relatively low. Alternatively, you'll notice the US, shown in teal, peaked just after the EU, but had a much slower decline in newly reported cases. And while the EU's case counts are stable at this time, our case counts are skyrocketing. There are many reasons why this could be true, but I want to show you a few states in our nation that are seeing increases in cases. and may be contributing to this rise. So these graphs, which were published in the New York Times the other day, document the increase of cases in 8 different states across the country. There is a sharp rise in the number of reported cases in many of these states. And as we've seen over the last 4 months, as our case counts increase, so do our hospitalizations, which I'll discuss in a few slides. So it's important to monitor these numbers closely to ensure our hospitals do not become overburdened. And for those of you who've been following this pandemic closely, you may be wondering if the increase here is simply due to an increase in testing. Are we testing more people, therefore we're getting more cases? And there are several metrics that we can look at to answer that question. But I just want to show you the total number of tests administered in the US over the past few months. But in particular, I want you to look at the past few weeks. So this graphic, again from Oxford University, shows the total number of tests by day since March 8th. While the testing trend is undoubtedly upwards, if we look a bit more closely at the past month, we start to see testing trends beginning to plateau. And that's the area that I boxed in the red there. This is important because if it truly were the case that testing was contributing to our case counts, then we would see a continued and sharp increase in testing. But what we're really seeing is a plateauing of our testing capacity, around 500,000 per day. So despite testing similar numbers of people over the past month, we are beginning to see a spike in our cases. Most strikingly are the increasing number of younger individuals being infected by COVID. Many states and some counties in Colorado are reporting that the 18 to 40-year age group are becoming infected at higher rates than all other age groups. This is problematic because there appears to be a tendency for younger, healthier individuals to have fewer or milder symptoms, or really none at all. They may be asymptomatic, but they can still spread the disease. So we have to remember that this is really a collective effort. Just because we personally may not be worried about the risks of COVID to ourselves, it doesn't mean others feel the same way. And by wearing our masks, keeping our distance, and staying home whenever possible, we reduce the likelihood that this disease can be transmitted to vulnerable populations, such as those with underlying health conditions and those over the age of 65. To reinforce this sentiment and this concern, I want to discuss the disturbing recent rise in hospitalizations in 2 other states. I captured 2 screenshots here, one from Texas, which is on the top, and one from Florida on the bottom. These are both states that began to open their economies earlier than was advised by the White House Coronavirus Task Force. The top chart shows the total number of people hospitalized by day in Texas for COVID-19. Back in February and March, the news and public health departments consistently reiterated that we needed to, quote, flatten the curve. Flattening the curve means we reduce the number of cases in order to ensure our hospitals don't become overwhelmed. Unfortunately, we're beginning to see hospitalization rates in states that opened too early and with looser restrictions beginning to spike. Take a look at the table on the bottom. This table is posted on Florida's COVID-19 dashboard. The table says that Florida has somewhere between 4,296 and 6,444 ICU beds across the state. As of Tuesday, Florida is estimating that about 4,229 people were in the ICU for COVID, which would put their ICU capacity anywhere between 65 and 98%. Our goal must be to continue to keep hospitalization rates low so that everyone who needs a bed will get one. A final note about hospitalizations are that hospitalizations typically follow new case reports by about a week and a half or 10 days. This means that it takes about 10 to 14 days after we begin to see an increase in our case count until we see our hospitalization rates increase. And to expand on that, death data usually lags another 2 weeks after hospitalization rates. So I don't want us to get confused. With this recent rise in cases, we may begin to see a rise in hospitalizations, not just here locally, but nationwide. We may begin to see an increase in a steady rise in hospitalizations, which could possibly contribute to a rise in deaths across the country. The recent spikes actually caused the CDC to just readjust the numbers of deaths that they are predicting by mid-July to over 150,000 total for the entire pandemic. So as a reminder, the majority of persons with COVID-19 can recover at home and won't require hospitalization, but a medical provider should always be contacted when someone infected with COVID is concerned about their health or needs medical attention. So you should not avoid going to a hospital if you feel that you need that care. So that was the national picture. Now I want to talk about where we're at here in the county. The graphic here is our county's roadmap to reopening in a safe manner. Dave with Aspen Valley Hospital and I are going to discuss these 5 markers between our 2 presentations. I'm going to cover the first step, which is looking at a sustained decrease in cases, and the 4th step, which is how well we are able to monitor and investigate confirmed cases of COVID in Pitkin County. Following my presentation, Dave at AVH will walk you through where we're at in regards to the 2nd, 3rd, and 5th markers, which are hospital capacity, testing, and protocols. So let's start with the first step, which requires us to have a sustained decrease in number of new COVID cases for at least 14 days. In order to discuss this step to reopening and where we're at, I want to remind you that our website is updated each day with our current data. The URL is at the bottom of this slide, but can easily be found by going to the Pitkin County website. To answer whether or not we're seeing sustained decrease in our cases, I'll be using the data on our dashboard that you can access as well. And Dave will end up going through some of the metrics on our dashboard as well during his presentation to cover the pieces of the roadmap that he'll be talking about. So on the bottom right of our dashboard, when you log into the website, there are 2 graphs that are specific to Pitkin County residents. The bar chart on the top is called an epidemic curve, and it plots 1 data point on the graph each day a Pitkin County resident tests positive. So for example, on March 14th, way on the left, the health department received a report of 1 person in Pitkin County who tested positive. And as you move across the graph, you can see the number of individuals that were reported to the health department by day who had tested positive for COVID. Pitkin saw a flurry of cases in March, April, and early May, with a standstill for a couple of weeks without any newly reported cases. However, in the past 2 weeks, several more cases have been reported in Pitkin County residents. In general, we like to see a bell curve, which means there would be a small number of cases on the left side of the graph, a peak in the middle, and a decrease on the right, and then the pandemic or the epidemic would be over. We saw that initially, but now we're potentially beginning to see a new peak or a new set of cases beginning to emerge. What this graph tells us is that we are not seeing a sustained decrease in transmission here in Pitkin County. This means that in regards to the first step on the roadmap, we're not currently meeting that criteria. And looking at the bottom graph, 11 of our county's cases have been reported in persons who are between the ages of 20 to 29 years old, which while it's still lower than the 50 to 59 and 60 to 69 age group, we are expecting that this age group may begin to increase in case counts if it follows a national trend. On the top of our dashboard, we have a few pieces of data that are specific to the Roaring Fork Valley that we track daily. In the top left, we've included total number of cases among Colorado residents, which is approximately 31,155 total that have been reported throughout the pandemic. Here in Pitkin County, we've confirmed 86 cases with 2 associated deaths due to the illness. In the regional case summary box right below, we've included our 2 neighboring counties, Eagle and Garfield, as well as the state of Colorado as a whole. Here we report the number of total cases for each county, the total number of deaths for each county, how many cases were reported today, and what our 7-day average is. The 7-day average takes the total number of new cases that we've had over the past 7 days, and it averages them out. So that last column, entitled Trend in New Cases, will compare today's 7-day average with yesterday's 7-day average. And it'll let us know if we are stable, increasing, or decreasing. So as of right now, you'll notice that Pitkin County is stable because our 7-day average today and yesterday were about the same. But as we begin to see more cases, we may see that daily average begin to increase. So it's something that we closely watch and monitor. Finally, on this topic of sustained decreases in cases, this graphic comes from the CDC, and it looks at mobility data in each county across the U.S. And so I pulled the data for Pitkin County. The different lines show the different types of mobility, and the gray bar charts in the background show the percent change in mobility. So the gray bars closely resemble Pitkin County's case counts. If you remember back onto that epi curve on this slide right here on the top, you'll notice that the gray bars pretty closely resemble what our case counts look like. So this suggests that as we begin to move around more and as our mobility increases, we tend to see more cases. So it's important for all of us to continue to be aware of how much we're moving around and ensuring that as we move and go places for essential functions, that we continue to keep our distance as that remains extremely important. So as far as sustained decrease marker, we're not quite there at this point. With increased travel and mobility, not just here in the Roaring Fork, but across Colorado and the country, we're seeing an increase in cases. And so now lastly, I just want to briefly touch on case monitoring, which is the fourth point, and I'll do this by discussing our box-it-in strategy, which we've discussed in the past. So the box-it-in strategy is the strategy that the county has adopted to ensure we can get our community back to work, and includes our fourth step on the roadmap related to case monitoring. But we need to remember that this is a collaborative effort among all of us. So this box-in strategy works starting at number 1 in the top left corner, which is where we need to ensure we have testing widely available, which Dave will discuss next. But to touch on it briefly, AVH and some of our local providers have provided an extensive amount of testing here. It allows us at the health department to really do our job, which starts at step 2. And step 2 is when we receive a notification of a positive result, we call that individual to ensure they have the information they need, and we ask them to isolate until they are no longer infectious. During this phone call with the patient, we ask them who else they may have been in contact with while infectious. This may be the most important piece because it allows us to identify anyone who may be infectious right now and is continuing to go to work or the grocery store or simply be out in public. And so our goal there is to contact them and to make them aware that they may have been exposed so that they can isolate. When we speak with those close contacts, we generally recommend a quarantine of 14 days so they can monitor for symptoms. If the case, sometimes the length of monitoring can be shortened if the person is confirmed with COVID, but in general, we require a 14-day quarantine. And so if the person that has been asked to quarantine ends up not testing positive, then after the 14 days, then they haven't developed any symptoms, they haven't developed the disease, and they would be okay to discontinue isolation. If they do test positive, then the box-in strategy essentially starts all over. And so we continue to use this strategy to really monitor and kind of help guide us in our practice. And it's also the strategy that we use to really ensure that our case counts are remaining low and that we're really boxing in the virus and ensuring that it doesn't spread. So lastly, before I hand this over to Dave, I want to reiterate my main points here. We're seeing an increase in cases across the U.S., and we're beginning to see more cases here in Pitkin County. We can't get complacent, simply put. This is a collaborative effort that takes all of us. We must continue to wear our masks when in public and even around those who we know well. We have to operate under the assumption that everyone around us may be infectious, which means we need to continue to distance ourselves from others by at least 6 feet, refrain from prolonged in-person conversations with others, and stay home and call our primary care doctor when we feel sick. So thank you, and I'll now pass it over to Dave.
Great, thank you, Josh. Very well done. Again, this is Dave Ressler. I'm the Chief Executive Officer of Aspen Valley Hospital, and this is Josh. If you can, there you go. I'll go ahead and bring up some additional information and slides to review. Okay, can everybody see that?
Yep, we've got you, Dave.
Okay, I'm trying to go to full screen.
In the top right, there's a present button.
There we go. Thanks for your help. So I'm going to pick up the couple points that Josh said we would with regard to the roadmap to reopening and the 5 criteria that hopefully by now everybody in the community is really becoming familiar with. And the first one that I wanted to touch on is the second of the 5 criteria, which is that hospitals are safely able to treat patients without resorting to crisis standards of care. And so as Josh referenced, this is posted on the Pitkin County website and is available for your review at any time. It's important to note that it will only change when the status changes with regard to one of the three categories: inpatient hospitalization, our average daily visits, or the number of essential healthcare workers that we have out ill with COVID-like symptoms or actual COVID positive tests. So we are currently running in all three categories as comfortable. So that means that we are below the threshold levels that are identified in the cautious column. So for example, we have greater than 50% capacity right now in the hospital for inpatient purposes. And in the average daily visits, however, and going back to some comments that Josh made, this is where we are really starting to observe increases, as I'll share with you in a minute. The emergency department isn't yet really seeing a large number of patients. We're still well below this average of 6 per day. But the Respiratory Evaluation Center, we actually hit 10 on Tuesday, and we've been running close to that for the past couple weeks, and similarly with
We lost your audio there, Dave. Dave, we lost your audio. Not sure what's going on. We can see your screen, we just can't hear your voice. So we've lost audio from Dave Ressler. We're trying to get that back now. Nope, still can't hear you, Dave. Let me try muting him. So I just tried to mute you, and let's unmute you there again, Dave, see if that comes back. Nope, still can't hear you. Nope, still can't hear you, Dave. Tracy, I'll let you decide if you want to jump to someone else.
Andrew, can you hear me?
We can hear you, Tracy.
Okay, so yeah, maybe we see if Dr. Bernard has audio, and we'll jump to Dr. Bernard, and then we can always see if we can bring Dave back in for his presentation.
Okay, this is Catherine Bernard.
We can hear you just fine.
Can you hear me?
Yep.
Okay, great. Well, you know, I can summarize what Dave was going to say, and reiterate what Josh already said, which is we're starting to see an increase in positive cases that we're testing for through Aspen Valley Hospital, not just because we're testing more, but because there are more positives. So there's a higher percent positive. These cases so far, they're not that sick, and as Josh pointed out, you know, they're in a younger range of patients. So that's good for the hospital right now, but it's bad because this is a stealthy virus. It can live for anywhere from 2 to 14 days in your body, causing very little symptoms or no symptoms at all, while you're still able to spread the virus. So that's problematic for a couple of reasons. Asymptomatic people may be spreading virus without knowing it and putting other people at risk. Also, it may take 2 to 4 weeks to see someone actually get sick enough to need to be in the hospital, to need to be ventilated, and to die. And so when we see this early warning sign, younger people getting sick, maybe without even symptoms, the increased positivity of tests that we're doing, that worries us for what's going to happen in 2 to 4 weeks. And we are seeing increased cases in the ER. We are. They're not being admitted yet, but we all have concern. So, you know, I'd like to just say that we have some control over this because we can control our own behaviors, right? And we've been talking about this over and over, and you can see Dave's still in the hospital, so he's actually wearing a mask. If we cover our faces in public, if we avoid closed spaces with poor ventilation and crowded places, or if we have to go somewhere like that, we wear a mask, we can prevent some of the spread of this virus, at least slow it down. You know, as more people start mixing and getting closer together, this becomes more and more important. And I just like to recognize that I know this has been confusing. People have said, wear a mask, don't wear a mask, you need this kind of mask. I just want to point out that science is about taking all the information that you have and then doing the best you can to find the best solution. And I'm a medical doctor, so I'm trying to prevent loss of life. I'm trying to tell you, do these things, because I believe that in 2 to 4 weeks, if we're all doing this, less people will be infected and ultimately less people will die. An epidemiologist is a little different than a medical doctor. You know, they're studying the determinants, the distribution of disease factors. And so sometimes as we learn something new about a virus like COVID-19, they change what they recommend, because they learn that there's a lot more asymptomatic people who can spread this by just speaking within a close distance. And that's why they're recommending that we cover our faces, that we keep our distance, that we limit those closed spaces and those crowds as much as we can. And now as we're seeing increased case counts, and I bet you're all seeing too, decreased face coverings and more people mixing together, these recommendations are just so much more important. So I echo what Josh said. We cannot be complacent. I think I implore you to do these things as best you can. And I think Dave has video back, or audio, so you want to try again, Dave?
Can you hear me now?
Yes, Dave.
Can you hear me now? Okay. All right, I'm going to...
So Dave's just getting
Can you
his
still hear me?
presentation back up. Yep, we can hear you, Dave.
Okay, for some reason I'm back with the computer, so we'll keep rolling here. And thank you, Dr. Bernard. That was excellent. So where I believe we left off was explaining that we are concerned about the number of visits that we're encountering, and we are getting very close to the point where we may have to move cautious. And as Dr. Bernard pointed out, downstream from that, 1 to 2 weeks, is when we would be concerned about seeing increased hospitalizations, and Josh referenced that as well. So we consider this to be an early indicator with a high degree of predictive value to say that these increased visits that we're seeing could lead to something much, much worse if we don't address them. So let's talk a little bit more about testing. I think there continues to be great interest in the testing that we're doing in the community. So I'll spend a little bit of time talking about the hospital's contribution first, as Josh described, to the box-it-in strategy, but also talk about more broad testing that we have available. We have numerous types of testing, all that are available to the community, but there are specific circumstances in which each may prove useful. So first, let's talk about symptomatic testing. So that is anybody that is experiencing symptoms that they believe may be related to COVID. If they're moderate and severe, if you're really suffering, or certainly if you are having difficulty breathing, then you should seek medical care. Call your primary care physician, or if you feel like you need to, come to the emergency department for treatment. And we will test you here as part of that process. If you're only having minor symptoms, runny nose, sore throat, chest congestion, etc., call your primary care physician. And if they believe you may have COVID-related symptoms, they will refer you to our respiratory evaluation center. As we talked about before, if you don't have a primary care physician, I'll put a slide up in a second with a phone number that you can contact, and we have primary care physicians available to help you here at the hospital. These are the nasal swabs. These are PCR tests that we're performing. It's a very pleasant experience that they are, but it's over very quickly. Once you have been tested, it's really important that you self-isolate until the results are received. But we have very good news on that front, and that is we are now performing all of these symptomatic tests on site at the hospital. So the results are available within hours. Sometimes if it's done late in the day, it may be available the following morning. So you don't have to wait long to get your results. As Josh described in the box-it-in strategy, positive results will result in the contact tracing process. And negative results, our physicians want to continuously remind us, are not any kind of assurance, and we should not discontinue our practices of wearing our masks and washing our hands, etc. So there is no reason with a negative test to believe that we are safe. It just means that we are not testing positive for the virus at the moment. So once again, if you have symptoms, call your primary care physician. If you don't have one, call 279-4111 to talk to our primary care practice. And I also want to remind you, if you do not have health insurance, you will not be responsible for the cost of the test. It is free to you. We will bill your insurance if you have it, only because we want to make sure that the insurance companies are paying their fair share. It's only fair. So I have some additional data that will simply be somewhat duplicative, but take a slightly different look at the data that Josh shared earlier, and it's available on the Pitkin County website. This is the daily tally that we maintain of patients that are coming to the hospital, either to the for purposes of the community test or because they want to be evaluated, as I described earlier in the respiratory evaluation center. What's alarming to us is if you look, you can really see a spike up starting around June 15th. The only reason the community testing in orange and the respiratory testing in blue drop off temporarily is because that's a weekend. And until recently, we were only open on Saturdays and we weren't getting a lot of referrals, but we are now going to be available. We are working on being available 7 days a week because we believe that the demand is there. But you can see that we're almost doubling in the activity. And if you look at the trend lines, both of those are increasing. In terms of the positive test results that we are receiving, as Josh said, we've had 56 total. And you can see that earlier in the year, up until middle of May, we had one, maybe two a day. One day was three, and then we had long periods of time without any positive tests being recorded. And then in the last couple of weeks, again, starting on June 15th, we have a high concentration of positive tests. And clearly there is a pattern there where we are starting to see many more people presenting with positive tests. So as an overall summary of what we've experienced as through yesterday, we've now tested over 900 people. 56 again have been positive, 838 have been negative. That is a 6% positivity rate, which is something that the county watches very closely, as you know. And the 10% mark is what we want to definitely stay below to suggest that we are, A, doing enough testing, and B, not having too much of a viral outbreak. And this 6% has climbed just in the past couple of weeks from 4%. So we went from 4% to 5%, passing through 6% now. So I agree. It is time to stand up and take notice. Let's talk a little bit about the asymptomatic testing. This question comes up a lot. When is it appropriate to get a test when you don't have symptoms? First, it's important to remember that typically a positive test runs parallel to the symptoms, and it takes 5 to 7 days for either to occur. So that's one reason to not rush out and request of your physician to be tested just because you happen to eat at a restaurant where you all of a sudden hear that they had a waiter test positive, because it's not likely. But let's talk about the reasons to get tested. First of all, medical testing is something we will do. So that is, we test our patients that are going to have a surgery or any other kind of procedure that aerosolizes, that sends particulates floating around that can endanger our staff or other patients. And so we want to make sure that we know if somebody is positive. So a couple days before the procedure, we will test them to make sure that they are negative. We have had positive tests on a previous slide. You have seen that we've actually had now 7 patients test positive that are asymptomatic. So it is possible to have the virus, as Josh was explaining earlier, and shedding it and not know it. And so these are some of the people that we've identified. The second category are exposed persons. So those are the contact tracing. And this is where public health will decide. Not everybody, just because you happen to have been near or even in contact with somebody that ends up being tested positive, doesn't mean you've necessarily been exposed. The health department can explain that to you. Generally, you have to be within 6 feet for more than 15 minutes. And not everybody that's considered exposed, as Josh was explaining, will necessarily be tested. It's a function of the health department determining whether or not the virus is spread. But if they do want you to be tested, they will refer you to ABH for testing. The next category is prevention. The health department is initiating testing of certain vulnerable populations in confined settings, congregate arrangements, where they are just making sure and doing a baseline test that there isn't already virus present. We may test staff in those situations over time to make sure that they're not introducing the virus. These two categories of exposed persons and prevention, we are very fortunate now to announce that we have funding available that has generously been made available by a local philanthropic group, the Rescue Fund, which you've read about for other purposes. The 2020 Rescue Fund, which is being administered by the Aspen Community Foundation, has provided us with a grant of up to $470,000 to pay for up to 3,000 of these tests between now and the end of the year, at no charge, obviously, to the patients. They have raised, through the Rescue Fund, over $4.9 million so far, thanks to our generous community. And they have allocated $2.1 million of that, including this grant. And I'd just like to call out our leading philanthropists who have led this effort, Mr. Bob Hurst, Melanie Lewis, and Jerry Greenwald have been instrumental in raising the funding to be able to help Pitkin County and ourselves provide these tests to our population at the direction of public health at no cost to the patient. The next category is physician referral. That is a opportunity if you would like to be tested because you're traveling to Maine or Alaska or one of the other states that requires tests prior to traveling there. You can have a asymptomatic test performed through our laboratory at the hospital. And you simply need to contact your primary care physician. They can then do one of a couple things. They can either provide the test in their office. Many physicians now have access to these saliva tests. And by the way, for all of these asymptomatic tests, our test of choice is saliva testing. It's easily collected. It's still a virology specimen, and it doesn't expose the person receiving the specimen. Your physician may also write an order to have, again, that test provided through our laboratory. As I mentioned at the beginning of the discussion about asymptomatic tests, however, it doesn't make sense, and your physician will explain that to you in all cases to be tested. And when they do believe that it makes sense for you to be tested, they're going to want to wait 5 to 7 days after you may have been exposed for that test to occur. And we send these tests out. And so it takes 2 to 3 days for the results to be returned. And finally, our physicians will always remind us, and your physician will remind you, that just because you have a negative test, it's just a point in time. You could test positive the next day or be infected the next day. So it doesn't mean anything with regard to letting down your guard and not protecting others. Finally, antibody testing is available at the hospital. We've done hundreds of these tests so far. They are ordered by the physician. We can do them on site. We also have the ability to send them out. But it is a conversation you need to have with your physician about what value an antibody test might have for you. We've talked a lot about this in the past, and it is not something that would be any indication that you have a level of immunity. The science just isn't there to suggest that somebody that is positive for antibodies has any level of immunity or lasting level of immunity. So you have to be very clear about what the purpose of antibody testing is when you have that conversation with your physician. Okay. That brings us to the 5th of the 5 criteria that Josh reviewed and said that we would review. And this is where Dr. Bernard jumped in and said her piece as a physician, somebody that sees the downstream effects of what happens when our community doesn't protect each other. So I totally agree. We need to create a culture of caring and respect for one another. When you see somebody with a mask, they're protecting you. And that is what we want to create in this community, is that environment where we feel safe, because when we're within 6 feet of somebody else, and particularly when we're indoors and in crowded spaces, that they have their masks on. And so let's do that for one another, and let's show through our actions how our community is responding to this crisis for those that visit us, and inculcate them in our culture of protecting one another and respecting and caring about one another. So I appreciate Dr. Bernard, as always, so passionate about this and so articulate for picking that up. This is where I otherwise would have left off. So with that, I am, once again, our 5 commitments of containment reminder and the 3 C's: avoid closed spaces, crowded places, and where you're going to be close to one another. I will go ahead and stop sharing now, and I believe that Allison Daly follows me with her presentation. Thank you for listening.
Hi. So my name is Allison Daly, and I run Pathfinders. We are a local nonprofit that serves from Aspen to Parachute. We provide free and low-cost counseling for those struggling with any kind of serious illness, as well as all kinds of grief and loss. And I was talking the other day with some of the people from Pitkin County. We got to talking about how this COVID has caused so much stress and unrest and a lot of fear. And it's caused, it's just caused a lot of unrest because we just don't, there's so many answers that we don't have, and we don't know when it's going to be done. And as a result of that, I think now we're in a real stage of what I'm noticing. I've got people talking with me that maybe were clients, either they're current clients or clients that had come to me in the past, and they're coming back because we're in that stage of real fatigue. There's a lot of a lot of demands, and it's real hard when people are having to work with these masks. I mean, to do the right thing, we're wearing these masks and we can't see one another's expressions. We're not touching one another. I've got a lot of people that I'm working with that live alone, and they're really lonely. And so all of this stuff and doing the right thing can also cause fatigue. And so one of the things that I was talking about is some of the things we can do. I mean, here's one of the things that I do for myself. I come home, and because I work in a really intense work environment, I'll go take a walk, because I come home and my family's looking at me like, you are not doing so good right now. So I'll go take a walk, and I take huge, just deep breaths while I'm doing that. And I look silly, I'm sure, but I don't care, because I know that I really need to unwind and to just kind of let this stuff flow through me. So I think like the importance of, we always use the term self-care, and that term can kind of be overused, but it's like whatever it is that means something to you, that feels good to you, to take care of yourself, doing that and really understanding that right now, so many people are under fatigue. So many people, there's so much that's being asked and demanded of people. The other thing that I'm noticing is I've had a couple people that have gone back to work, and everybody in the work environment is under a lot of stress as well. There's people are, they're trying to keep their distance. They've got their masks. They're being asked to do jobs that they weren't asked to do before. There's all of these cleaning requirements. And so they're just really feeling that kind of fatigue. And one of the things that I've talked with some people about is, when you come in contact, let's say you've got someone who is really having a hard day. And one of the things that we do is we tend to take on what other people sort of give us. And one of the things that I tell people is, let's say you're going into work and you know that it's going to be a stressful day. One of the things you can do is, and I call this the mirror effect, where I just imagine that I've got a mirror on my forehead. And what I do is I just ask that whatever somebody's trying to give me or whatever's going on with them, that I don't take that in, that I just let that be their experience. So I just imagine that whatever's coming at me goes right back to the person that it belongs to, and that I'm not trying to take on too much. Like, for example, let's say somebody calls you and they're mad about something. That's, unless I've done something wrong, that may just be their anger and their stress over what's happening in their life right now as a result of COVID. So there's that tool where it's really about just letting other people own what they own. The other thing is the aspect of, I always call it, another thing that people can think of, and I really like analogies because analogies make sense to me. And I call it the box. And that is, let's say somebody is, really in a panic about around the COVID. And it may be because they've got a lowered immune system, or they may have something that is going on or they're really upset that people are not wearing masks or whatever it is. And so I always say, you want to be present with them, and you can help them kind of hold this literal, like this box of their stress per se that's going on, but you don't want to take that on. So at the end of the conversation, you listen and you hear them and you appreciate what they're saying, but you also figuratively, you give them back that box that they're carrying, because that's their experience. And it's really about just realizing that we've got so much going on in our lives right now, and we're having to deal with so much stress and pressure, that we really don't need to take on anything that doesn't belong to us. And to realize that everybody's got a different experience. Everybody has different reasons for why they feel. And instead of judging, or instead of, getting upset with how they feel, if we can just let it be okay for them to have that experience, and then we know that we're just doing our part, like what Dave was saying, we're wearing our mask, we're being as proactive as we possibly can, and we're doing what's right, but we're not taking on what other people are trying to give to us. The other thing that's important to realize, and I try to talk to people about this as well, is, it's important for us to have a healthy amount of fear. We want to respect this virus. We want to honor what is happening. And like you look at the numbers that just happened, it's important to honor that and to really respect it. But to go to a place of deep fear and maybe unhealthy fear, it causes our own immune system to lower. And that isn't helpful to us. That's not a supportive thing. So, you know, we want to work on sort of trying to balance this idea of respecting and honoring it and doing all that we can and setting up precautions. But if we have something that's going on with us that is paralyzing us, to realize that, wow, that could actually, you know, not that it necessarily will, but it has the potential to lower my own immune system. So I don't really want to go there. I want to try to stay as balanced as I possibly can so that I'm able to show up for myself. So in all these cases, what I'm really trying to demonstrate is that we want to take and own the aspects of ourselves that belong to us. And we want to let other people own and handle the things that belong to them. And if anybody needs any support around those things, we would love, Pathfinders would love to support and help you around that, because, you know, this COVID issue really encompasses so many things, but it is an illness, and even the fear around getting it can cause real stress. And so just know that we're here to support and help you.
Allison, thank you so much for wrapping up with that and being here. I just think it's really important to keep hearing that, you know, and that we talk about being in this together, and I love what Dave said about that culture of caring. This is a place that really cares about the people that live here, about the visitors that come here. So let's keep up that really good work. I also think, I guess, Allison, I should ask you a question, but anybody who might have interest in talking to you about coming to talk to their business, or, you know, should they just catch you through Pathfinders maybe?
Yeah, my cell phone is 970-379-5276. And I've offered to a couple of businesses to come and just talk for free, just to let the let the people within the business be able to process and really understand the validity of the fatigue and the fear and all those things, and just to give them some possible tools.
That's great. So I'm going to wrap today's meeting with just a few communication channel changes that we've had. So for the whole event, you've had us talking about the hotline. In the beginning of initiating the hotline, we actually had volunteers that were able to answer questions. Well, we're going to morph the hotline into what we'll call an information line. And so essentially what it'll do is have a call attendant. So again, it's like you call in and you push 1 if you have questions for testing. You push 2 if there's, you know, information you're looking for just in general from Pitkin County. Number 4 on the menu is a big one, because we do have a forum being created around compliance. We know there's a lot of people in our community. There's a lot of people concerned about activity they see. We really have the Pitkin County Public Health team, the City of Aspen, a lot of folks working on that compliance angle. But I'll go back to, they're really hoping that's more of an education than it is, you know, punitive. So again, the more we can kind of support and help each other through that would be great. But that hotline moving to an information line, our goal really is to have that up and running by the end of the day tomorrow. We've been working on it this week. So more to come on that. The number doesn't change. So the number that's been out there that's on all our collateral stays the same. So we're not trying to throw you a loop and send you somewhere else. That number stays the same, but the service is a little bit different. And when you choose a menu to go to, it'll provide you either more information or potentially another phone number to contact a person. But we really are just trying to find a way to provide good customer service to you, but we're still building out a team, if you will. So just bear with us on that. Everybody did such a fantastic job today talking about the commitments and the 3 C's. The fantastic communications team on COVID who have supported me and all of us through this will recap this meeting. So if you missed any of the phone numbers before, go to our website, the pitkincounty.com website for COVID, or the public health Facebook page, because our team does a really good wrap up. And with that said, I'll ask the group while I have you, if you did a presentation of slides, if you'll email me your slides, that'll save a step later of me trying to track you down. But we do try to use your data slides and share that information for people. This meeting is also recorded, so you're able to see it again if you've missed anything. But we plan to be back again for community meeting in 2 weeks. We'll have a better sense next week of the flavor of what will be on the agenda for that meeting. But again, I can't tell you how grateful I am to all of you for being here and the important messages you share. and to our community for continuing to support us and recognize we're human beings on the other side of this tough conversation. So if you have ideas, we're open to hearing them, and send them in, and we'll do our best to provide information or the things that you're looking for. So thanks for joining us today. Have a great day. Stay healthy. Keep your mask handy. I mean, we're trying to think of all kinds of things. You know, most of us don't go anywhere without these, right? But now we just have to remember that these are connected to these somehow, and we'll never be without what we need. But thanks again. Have a great day, and we'll see you soon.